Hi, my name's Rhiannon and I'm the Clinical Specialist Physio in Pelvic Health, and this is Coral.
My name is Coral Seymour, I'm one of the Clinical Urology Specialist nurses at the Royal Gwent.
And we're going to talk to you today about pelvic floor exercises, some videos on fluid advice, catheters and pads as well. A little bit about the process that the men go through from a continence point of view before kind of surgery.
Okay, so before the day of surgery, you'll be given an appointment to come and see us in the pelvic floor clinic. This is important to show you how to do the exercises correctly. You'll either see myself or one of my colleagues, and we will examine you visually to ensure that you're doing the exercises correctly. It's quite hard to do pelvic floor exercises, and it's important that you get the technique right, otherwise you'll be squeezing till the cows come home and nothing happening. So we will examine you just to make sure you're doing them correctly. We can see that from the scrotal lift and the penis retracting. Also in clinic we'll discuss, as well as pelvic floor exercises, also pad management and how to care for your catheter. You'll be seen either by myself or one of my team 6 weeks after the day of surgery, and then we see you again until your continence is regained. So you'll be seen every 6 weeks or 3 months or 6 months until you get dry. We're not just going to leave you, you will be monitored and supported throughout the process until you regain continence. So if you do need more intensive pelvic floor physiotherapy, I will do a referral to Rhiannon.
So you'll either come to see me or one of the other physiotherapists in the health board who treat men. And what we look for is how well that pelvic floor muscle is functioning, what we can do to really narrow down what's going on with that pelvic floor and how we can help you with your continence. What we offer men when they come to see us is to do a digital anal rectal examination. So that's an examination of the back passage with a gloved finger, and what we do there is we feel the pelvic floor. So we feel what's going on, how well it's moving, how strong it is, what's the endurance like of that muscle, and then that gives us a lot of information then as to how that muscle's functioning, and then can give us clues as to how we need to train that muscle then to help the patient with their continence.
So I'm just going to give you a quick overview on your anatomy. I have a diagram here to show you. So if I just point out all your bits and pieces. So this is your tummy and this is your bottom. It's a side-on picture. So first of all you've got your bladder here, and then this is your water pipe or urethra that comes all the way down, bum, 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 right down to the end here. This is the prostate gland, which is obviously removed during surgery. This is your scrotum. And then that's the tube that takes the sperm up and around and through. Your pelvic floor muscle goes from the bone here at the front that you can feel right through to your tailbone here at the back. And obviously your water pipe is in the middle of this pelvic floor muscle, a bit like a donut. When you have your operation, you have your prostate removed. And obviously this affects your, what we call our continence sphincter here, which is a little valve at the base of the prostate, which helps to keep us dry. When the prostate's removed, the bladder is brought down and stitched to the urethra here. Obviously because this valve is affected, you're more reliant on your pelvic floor muscles to keep you dry, which is why we discuss these exercises and muscle training in detail. When they take the prostate out and they bring the bladder down and stitch it to the urethra here, it can cause some narrowing or some scar tissue, which is why whenever you come to clinic we always ask about the flow rate to make sure that you're passing water with a good stream, because we want to make sure that there's been no narrowing at this junction here where the bladder is stitched onto the urethra. As I mentioned, your pelvic floor goes from this bone here at the front right through to the tailbone at the back, and it circles your back passage as well. So it's important, you can see how close your rectum is to the urethra and your urinary tract, so it's important to avoid constipation, because if you have a loaded rectum it can actually push up against the water pipe and cause further problems with flow.
And also what you might find as well is if you're constipated and then you're then straining to try and empty your bowels, that can then weaken your pelvic floor as well.
How do you advise men to do their pelvic floor exercises?
Initially, what I always get patients to do is either lying down with their feet on the bed or sitting comfortably in the chair, whatever suits the patient the best really. And it's about getting that pelvic floor engaging and moving in the right direction. So it's really important that when you do your pelvic floor exercises that you start at the back. So you start off as though you're trying to stop yourself from passing wind, and then you move, squeeze round and forward until you feel as though you're trying to stop yourself from passing water. Another way to think about this is to pretend that you've got a tail and you're trying to curl that tail up in between your knees and then let it flop back down again. Or another alternative way is to think that you're taking your back passage up and you're squeezing up and forward towards your belly button. That's another way of doing it.
That's a good idea.
So there's two ways that we want that pelvic floor muscle to work. So we need endurance for stamina, so we've got ability to hold on as long as we need to be able to. So with this, when you're doing your squeeze, what you want to do is squeeze up and forward, hold to start off with for about 5 seconds, and then release. Then you want to repeat that then as many times as you can do, up to about 10, until you feel kind of fatigued. Once you feel that you can do 5 seconds and that's nice and easy, then what you want to start to try and do is to hold on for a little bit longer until you feel that you can do a 10-second hold and repeat that 10 times. If you find that you're struggling to do that, then just stick at what you're able to do, because that's where your level of your pelvic floor muscle is at that moment in time, and that's absolutely fine. The other way that we want that pelvic floor muscle to work is quickly. So when you cough or sneeze, you are able to, that pelvic floor muscle is able to react quickly to close around that urethra and hold off that urine from coming out. And with this, it's important about how you do that exercise. So a lot of the time we find that men do it quickly, but it's a quick contraction, so squeeze, 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 squeeze. What we're looking for more when we talk about a fast contraction is actually the speed of the contraction itself. So it's a quick, sharp contraction and then a slow release. Quick, sharp contraction and slow release. So it's the speed of contraction rather than the speed of the exercises one after the other. Okay?
10 seems to be the magic number, so can men actually over-exercise?
Yes, they can. So we recommend that you do your exercises about 3 times a day, and you're aiming for that 10-second hold 10 times and then 10 quick ones if you can do that. Try not to do it any more than that because the muscle needs time to recover as well. It's the same as if you were to go to the gym. You wouldn't go to the gym and do bicep curls every hour on the hour. You're going to feel tired. So it's the same principle for your pelvic floor exercises as well. You need to give it time to recover, so any fatigue is able to kind of manage that as well.
I find that some men find it difficult to actually squeeze their pelvic floor muscle correctly.
Yeah.
What can we do?
The key thing is down to technique, and like you mentioned, it's quite hard to do your pelvic floor. You don't really know where it is, you can't really see it. But the key thing is more kind of like what you shouldn't be doing. So I think one of the most common things that we see is that men tend to use their stomachs a lot more, so they tend to squeeze through their stomach to try and get that lift from underneath. Unfortunately, what happens then is that actually, because of how your abdominal muscles sit, they squeeze onto your bladder and can actually push urine out, so it can actually make the situation a little bit worse. So the key is to make sure that you're feeling nice and relaxed through your stomach and that lift is coming from underneath. Another thing that we can sometimes find is that people use their buttocks, so they squeeze and kind of feel that they're lifting up away from the chair. So ideally, again, if you're doing your pelvic floor muscles correctly, no one should really know that you're doing them at all other than yourself.
Another useful tip is what we refer to as the knack or functional bracing. And this is where men are encouraged to engage their pelvic floor before any activities such as getting out of a chair or getting out of bed. If you can just try and remember to squeeze your pelvic floor before you go and stand up, for instance, it'll help to keep you dry. It's very hard to remember though. You go to get up from a chair and you think, oh, too late, it's happened already. So try and get into the habit of remembering to squeeze your pelvic floor before you move.
Yeah, and the more you do it,
yeah,
the easier it does does get, and it becomes a
Habits, yes.
rather than a thought process. And the reason why we kind of suggest it is because when you go from sitting to standing, or you cough or you sneeze, the pressure that's resulted from that from an abdominal point of view pushes down on top of your bladder, and if you've got a weak pelvic floor, you haven't got that sphincter that support there, then naturally anything that's in the bladder is going to be helped out, which we don't want to happen. So if we can engage that pelvic floor and give a little bit of resistance from underneath to the pressure that's coming in from above, then that can sometimes be just enough to kind of help with the continence. So when it comes to doing pelvic floor exercises, we recommend that you do it about 3 times a day. It's up to you how you find that best fits with your day, whether you are, let's do it in the morning, mid-afternoon, evening kind of person, or if you prefer to link it with something that you do. So if you're, sitting or after you've been to the toilet and you sit back down onto the toilet, that's a good time to do it. Anytime you wash your hands, or anytime you pass the bottom of the stairs. It's about finding whatever works for you to remember.
Trying to remember, isn't it?
Yeah, definitely trying to remember to do the exercises. So initially with the exercises, we tend to get you patients kind of lying down to do them, because in theory that's the easiest position to do it in, because there's no gravity, there's no body weight acting on the pelvic floor muscle. Some people find it easier actually to do it in sitting, because you can feel yourself lift away from the chair and relax back down on the chair. So it's up to you what works best for you then, really. But then we always then try to encourage kind of like patients then, once they feel comfortable doing them in sitting, to try and do them in standing. If that's a little bit difficult, then sometimes a midway point is leaning up against the kitchen work surface, so you're upright but you're supported a little bit. That's a nice interim kind of like position to do it in, because chances are you're more likely to leak or have a problem when you're upright rather than when you're sitting. So it's important to make sure that we're working that pelvic floor muscle in a position that it needs to be in and work effectively to help you with your continence. Again, kind of like remembering tends to be like the thing that I find patients struggle with the most in terms of doing the pelvic floor exercise.
I forget to do mine. It's only when I'm talking to patients about them I think, oh right, I've done them today.
So there are a couple of apps out there if you're a bit more technologically minded.
Yeah, the phones are great, aren't they? Yeah. So you've got a reminder on your phone, or you could use the Squeezy app that you can download.
Yeah, so the Squeezy app, so there's a male version and a female version, so you can download that to your phone and you can set reminders on there, and you can set specifically a bit more information about your exercises, so how long you want to squeeze for, how many reps you want to do, and how much of a relaxation you get in between.
Really good age manual, I find that.
Yeah, really helpful.
Good.